My name is Satoru. I was the head of mission for MSF in Yemen. We are running projects to provide emergency care, but also surgical care, inpatient care, and now we're expanding our activities for maternal health care and nutrition to meet the different needs linked to the conflict. My role was to first coordinate all the humanitarian response that MSF is providing. I was also responsible for negotiating the security and acceptance of our teams and operations, so especially the fact that we are neutral, we are not part of the conflict, and we are providing life-saving medical care for the people who are suffering on the ground. Yemen is suffering from 2 years of escalated conflict. There's been heavy airstrikes all over the country. There's ground fighting ongoing. And as a consequence, people are suffering from a man-made crisis. And around 18 million people need some kind of assistance, of which 14 million need some kind of medical care. More than 10,000 people have been killed and 43,000 wounded. And more than 2 million people displaced. And the economy has collapsed, and also the healthcare system, which is exacerbating the humanitarian situation in the country. Unfortunately, since the end of March, a cholera epidemic has hit the country. The UN is reporting around 60,000 cases already and 500 deaths. They are warning that in the next 6 months, maybe even up to 150,000 cases might appear. MSF has responded very quickly to the situation. We've already treated 12,000 cases in 15 cholera treatment centers around the country. MSF is also supporting other MOH, Ministry of Health, cholera treatment centers. First, cholera is a highly contagious disease and potentially fatal, but we know from experience that it can be treated, and also the epidemic can be contained as long as there are proper measures put into place, including proper treatment, sanitation and hygiene control measures, and public education. But in order to accomplish that, we need medical staff, we need water sanitation specialists and other staff. Also, we need to bring in more drugs and supplies. And that all requires, of course, a financial backing, and this is where the international community must help, where to increase the aid coming to the country. But I would also like to remind that this cholera epidemic is just a symptom of the ongoing conflict, which has destroyed the health system. There are very little staff, medical staff left. Half the health facilities are closed. In addition, the access to clean water and sanitation infrastructure has been destroyed. And because people are displaced and also have less access to proper nutrition and food, they're susceptible to illnesses like cholera. So international community also has to address the humanitarian needs caused by the ongoing conflict.